All right. Hi, I'm Alyssa. I'm going to be doing a head, neck, and kind of observing your face and checking all of that. How can I address you? Claire. Claire. Nice to meet you.
Nice to meet you.
So starting with the head, inspecting the head and your skull, just noting the position of your head on your body, making sure it's nice and neutral and in proportion with the rest of your body. Inspecting the shape of your face as well as skin coloration, skin conditions, any hairlines, bruises, swelling, scars, anything like that. Taking note of your facial expression, which looks happy. Then looking at your eyebrows, seeing that they're nice and even and that they're not thinning on the lateral sides. Looking at the shapes of your eyes, making sure they're not like popping out at me or like sinking in. Which they look great, and then looking at your pupils, which look at equal size, as well as your eyelashes aren't folding in or, folding in, look pretty normal and symmetrical. Then looking at your nose, looking at the shape that it lines the midline, not deviated to one side, and that your mouth looks symmetrical and good shape, so it's good. Then you're gonna feel my, I would be wearing gloves for this, but we don't have gloves. So, I'm just gonna feel through your hair and feel your skull. Is that okay?
Mm-hmm.
Okay. I'm gonna come and I'm gonna look through the hair, looking for any hidden skin discolorations. If you had kids in middle school or elementary kids, looking for nits and lice. Looking for any scales, and then just feeling the skull for any like cysts or any pain or tenderness that the patient might have. Everything feels good. Any pain? Nope. Okay. Good. All right. Then I'm just gonna palpate the parotid gland, which is just right on front here. Feeling for asymmetry. Which they feel normal and not swollen or anything like that. Next, I'm going to listen to your temporal, so you'll feel the stethoscope kind of on the side, and then I'll listen to one over your eye. Okay.
Sounds good.
So here, so making sure it's on the bell side, and then listening for about 5 to 15 seconds. This side. Good. Then you're gonna feel this over your eye, just a little pressure, shouldn't hurt. So go ahead and close your eyes. Start with side. Move to the other side. Good. Okay. All right. Then we're just going to test cranial nerve number 5. So you're going to feel some light pressure kind of on your forehead, along your cheekbone, and along your jawline. And I'll have you close your eyes and just let me know if they feel the same. Okay. Good. So let me know if this feels the same. Same. Okay. Over here. Same. Okay. And then here. Same. Good. All right. Then I'm gonna. Then I would be testing the blink reflex with a cotton swab on the cornea. I would be doing this with a sterile cotton swab, so I'm not actually going to elicit the blink reflex. But what I would do is I would take a cotton swab and I'd have the patient, I'd have you look away, I'd have your face stay towards me, and then I just kind of lift up and I would touch the white of the eye. Then I'll have you look that way or to and then I would do the same on this with a different cotton swab, not the same one. Looking for that blink reflex. Then, all right, so then I'm gonna test the muscle portion of cranial nerve 5. So I'm just gonna have the patient, so I'm gonna have you bite down on the tongue depressor lightly, not to break it, but, and then I'm just gonna kind of pull away. So I'll have you open up, go ahead and bite it. Oops, there we go ahead and bite. Good, and looks good. And then we'll test cranial nerve 7. So I'll have you wrinkle your forehead. Good. Have you smile. Have a frown. Good. And then puff your cheeks. Looks good. Perfect. All right. So next we're going to move to the mouth and oropharynx. Starting with the lips, looking at the color, moisture, looking for any lumps, scars, bruises, cracking, ulcers, anything like that. Then I'm going to inspect the cheek. So I'll have you open up and then use my pen light, and I'm just going to looking for any bite marks, anything like that. Looking at the hard palate, looking at the gums, looking at the teeth, making sure they're all nice and pink. And then looking at the size of the tongue too, looking at size, color, and texture. Then I'll have you lift your tongue up towards the top, looking at the frenulum, and then looking at the ducts, making sure they're not blocked. So lift at the hard palate, which looks good. Then I'll depress the patient's tongue, have the patient say ah, looking at the tonsils and posterior pillars, look for any redness or exudate, which there was none, so that's good. And soft palate and uvula looks symmetrical, so that all looks good. So next, I'm going to test cranial nerve 9 and 10. So you're just gonna feel this touch the back of your throat, essentially. So I have you open up and just feeling on the back there. Okay, good. And then, which that was all normal. And then I'll have you stick your tongue out to test for cranial nerve 12, looking that the tongue comes out straight and doesn't deviate to one side, and isn't fasciculating at all. Then I'll have you stick your tongue out again. We would be using a sterile gauze pad. We don't have one, but I just have her stick her tongue out. I'm gonna grab her tongue, and I'm just gonna look at the sides of her tongue on each side for a better look, looking underneath as well as on top. All right, just to have, a better look. All right, then we're gonna inspect the external part of the nose, looking at it for symmetry and any deformities. And then we'll take a look on the inside of the patient's nose. So, okay, you're just gonna feel this go up your nose. I'll have you tilt your head back. Good. I'm just gonna hear. Good. Okay. Then we'll take another one. So looking good, looking at the mucosa, the color, if looking for any swelling or discharge, and looking for any perforations or deviations, and looking at the inferior middle turbinates, that's how you say it, for any color, swelling, exudates, or polyps, which there was none, so it looks good. So next we'll do the nasal patency test. So I'll have you take your right hand, cover your nostril, and then have you breathe in and out that nose. Good. Have you do the other side, breathe in and out. Okay. Get a little blocks on the left side. That's all right. All right. So now I'll palpate your sinuses. I'll start with your maxillary, and then I'll move to your frontal here. So just feeling the area for any swelling, heat, anything like that. I'm just gonna kind of push on it. Okay, let me know if you feel any pain. I'm just gonna percuss on them, okay? Any pain? No? Okay. So now I'm just gonna feel these sinuses for any heat, swelling, anything like that. And then here, can we percuss on them? Any pain?
No.
Okay, good. All right, so now we're gonna inspect the neck. So looking at the neck for skin tone lesions, scars, masses, edema, and unusual pigmentation, swelling. And then looking at the trachea to see that it's midline and not deviating to one side. And then I'm gonna use my third middle digit here and right above the, what is it? It's the supratracheal notch here. And I'm just gonna have the patient swallow, feeling that the trachea stays midline and doesn't deviate to any side. Then I'm going to inspect the thyroid gland, looking for any unusual swelling or anything like that. So I'll have the patient tip their head back and using a tangential lighting, and go on this side looking for any shadows. Good, okay. And inspecting any masses or asymmetry. So then I'm just gonna palpate here. Okay. Then I'm gonna have the patient swallow, again feeling that the trachea stays midline and that the thyroid gland isn't causing any deviations, which feels good. Next I'm going to feel the lymph nodes, so I'm just gonna come behind patient here, and then you're just gonna feel me feeling the lymph nodes. So starting with the preauricular, so right in front of the ear here, feeling that they're small, round, and even, coming to the postauricular, feeling those coming back to the suboccipitals and occipital lymph nodes, which feel good. Then coming to the tonsillar, down in here, working to the sublingual, or submandibular, and then sublingual. Alright, and then feeling the SEM, feeling the superficial cervical chain, and coming to the back side of the SEM, feeling the posterior cervical chain, and then feeling the supraclavicular ones, and then the deep chain is, I believe, deep to the SEM.
Mm-hmm.
So, and they all feel good, smooth borders. All right, so next I'm gonna listen to the carotid artery. So you're just gonna feel with the bell of the stethoscope. You're just gonna feel it just along your neck here, okay? I'm just gonna listen to the carotid artery here. Good. And then on this side. Good. Okay. So those all sounded nice and strong and normal. And then we're going to test for cranial nerve 11. So I'm just going to place my hands on the top of your shoulder and then lift your shoulders up. Good. And then we'll test the upper trap and SEM. So I'll have you look to this side, and I'm just going to have you push in, making sure that other opposite side SEM is firing, which it is, and I'll have you do the opposite side on this side, and then looking at that SEM to make sure it's firing. And it all looks normal, so that is everything.
Perfect.